Dear Dr. Polascik, could you briefly introduce yourself to our audience?
Yes, I'm a professor of urology and surgery at Duke University Medical Center, Durham, North Carolina. I'm the director of the Society of Urologic Oncology training program and also the director of the genital urinary focal therapy program in the Duke Cancer Institute.
Okay, could you briefly introduce the current status of focal ablative therapies for prostate cancer?
Focal therapy began as a concept. It began initially as a series of small studies, and I would say by 2008 we began to organize work groups around building the concept and translating it into a research and clinical practice environment. We've had a number of people over the world working on this, a number of investigators, stakeholders, companies trying to develop tools, instruments, and means to propel this concept forward. This has been growing internationally. We typically have an annual meeting that alternates between the United States and Europe, and we're hoping to set up an Asian site in the near future because this is a global effort to try to bring this technology and treatment concept to fruition. The current status, we have had in the last several years a number of clinical trials that have come to fruition. We've used a number of different ablative devices. Most of those studies are still small in size and scope, and we need to gain more experience and longer follow-up.
Yes, I think so. So what's the pros and cons of focal therapies for prostate cancer?
Well, the pros for most men that have prostate cancer is that this is a outpatient or day treatment of a cancer that is very likely to preserve urinary and sexual function. I think that's most appealing to men in a minimally invasive fashion. You can repeat this and you can survey any of the small indolent tumors with active surveillance in the meantime. So what we're trying to do is convert prostate cancer from an acute treatment-related disease to a chronic, manageable condition. Some of the cons or challenges with focal therapy are numerous. First, we would like to always see prostate cancer, so we're developing different imaging techniques to find and localize those tumors in three-dimensional space. We also need ways to determine the biologic aggressiveness of cancers. We need to be able to characterize which ones are indolent and can be followed versus which ones are aggressive and need to be treated. And then we have challenges with definitions of what constitutes focal treatment. Is it just lesion only? Is it ablation of a zone, etc.? And then we have challenges regarding how to measure outcomes. There are more challenges than that, but of course this is a long-term project that it's going to take many people, corporate sponsors, researchers to overcome these various challenges.
Okay, so for the challenges, do you have any advances to confront it?
Well, I'll use an example of how to face and overcome these challenges. So one was the introduction of multiparametric MRI to visualize these tumors. So we've used MRI for a number of years, but it didn't really have the ability to see these cancers. But when we built functional protocols into the MRI, we can now see them. So that's one example of overcoming an imaging challenge. And then another challenge would be, okay, now that we see it, how do we target it? And what we found is it's not always easy to have access to an MRI scanner. It's costly. It's not always available at one's institute to actually biopsy and treat patients. So we've had a number of corporations develop fusion devices where they could fuse the MRI technology to standard ultrasound technology that basically any urologist has in their office to do directed biopsies and potentially targeted therapy. So those are just two examples of ways in which companies have helped overcome those challenges.
So there's any follow-up care for the focal therapies for prostate cancer patients?
The follow-up care?
Yes.
Yes, it's very important. So we need to monitor these men very carefully. So remember that with focal treatment, we're treating one or maybe a few areas of the prostate, and we're not treating other areas. So we have two ways to monitor. Number one, we have to first make sure that the treatment was effective. So we typically do that with serial PSA tests, but more importantly with follow-up imaging and biopsy of the treated areas to make sure that we have eradicated the cancer. But then remember that there's a segment of the prostate that has not been treated and is on surveillance. So we need to make sure that the patient doesn't develop a tumor in that area that may need treatment. So fortunately, we could oftentimes monitor the entire prostate simultaneously with the use of multiparametric MRI, and then we can periodically do biopsies not only of the treated area, but any new areas that become apparent during the course of the follow-up.
So do you have any other things about the focal therapies for prostate cancer you would like to share with our readers?
Yeah, I think that this is here right now, and it's going to be growing and coming. I think that technology continues to evolve. We'll gain more experience with further research, and I wouldn't be surprised if this becomes a common entity in our armamentarium to treat prostate cancer. I suspect that it's going to be the way that men want to do this. I think there's a lot of benefit in not treating the entire gland. And again, as we overcome some of these challenges in the future, I think we'll see more desire on both the patient and the physician's part.
So, you have any suggestions to our young urologists for the focal therapies for prostate cancer?
I think that this is a great field to get into if one is young and wants to make a discovery. There's a lot of opportunity, especially in the imaging of prostate cancer. I think once we can see these cancers and characterize the biology, it's going to be a whole new ballgame for the treatment of men with prostate cancer. So this is a great field if you're young and eager to find a niche to get involved in.
So this is also the reason why you chose to get into this field?
Yes, I wanted to try to make an impact, and I think my underlying goal was, I'm getting older, and if I develop this and need treatment, I want to make sure that it's effective and can be done in a minimally invasive fashion. So I have a little bit of a personal stake in this, like a lot of other men do.
Okay, so the last question is, if you're not to be an urologist, what would you like to choose as your career?
I love surgery, so I would choose a surgical field. I think surgery is a fascinating field because you can really help people, and they come with surgical problems, and you can fix them and correct them, and hopefully get them back to good health. So I would probably pick another surgical field.
Okay, thank you. That's all.